Hey y'all, today's topic is painful periods, also known as dysmenorrhea. My name is Dr. Ipeleng and I am an OBGYN. I make videos about women's health. So you're welcome if you're new to my channel. If you are a subscriber, which I don't have a lot, you're also welcome. So painful periods may be much more common with irregular periods or heavy bleeding, but it is also common in other conditions such as endometriosis, fibroids, or pelvic inflammatory disease. Just a little bit of a background. So menstruation occurs when your uterus sheds its lining every month. This happens in every woman of a reproductive age, unless otherwise there is some underlying condition. So when your uterus sheds its lining every month, having some sort of cramping or some sort of pain or discomfort, it's very normal. But when you have excessive pain that stops you from going to work or going to school, that is definitely not normal. So dysmenorrhea or painful periods can be loosely classified into primary and secondary. Primary dysmenorrhea basically is when you have pain before and during your menses. And then secondary dysmenorrhea happens in people who before they did not have any pain during their periods, or they had normal pain or expected pain during their periods, and then later on in life they have severe pain during their periods. This can happen due to some underlying conditions such as endometriosis or fibroids later on when they get a lot more bigger. So what are the causes of painful periods? It's not always easy to find out the cause of painful periods, but there is a few people or a lot of people who are at a higher risk of having painful periods. For example, being under the age of 20, being a smoker, having never given birth before. People who don't have kids are at a higher risk of having painful periods. People with a family history of painful periods. Having heavy bleeding with your periods or having irregular periods, you are also at a higher risk of having painful periods. People who start puberty before the age of 11 are also at a higher risk of having dysmenorrhea or painful periods. Now I'm going to talk about some of the underlying conditions that cause painful periods, and I will just start off by the PMS, which a lot of us know. Those who don't know, PMS is a premenstrual syndrome, which is the beginning of some symptoms, psychological and physical, or rather mental and physical. And some of the physical symptoms include pain, right? Pain in your lower abdomen or in your pelvic area. So in people who have PMS, the pain will start 1 or 2 weeks before the menstrual period, and a few days into your menses, let's say maybe a day or two into your menstrual period, the pain will go away. Another condition that comes to my mind is fibroids. In a lot of women, fibroids do not have any symptom, but in those women who have symptoms, they will have some sort of pain, especially if your fibroids are too big and they are pressing against other organs in your pelvis. And also depending on the location of the fibroids and the number of the fibroids, you might have pain during your periods alongside excessive bleeding. Another condition also is endometriosis. Endometriosis is the location, rather, having the endometrium, which is the lining of the uterus, outside the uterine cavity. It can either be along the ovaries or on the fallopian tubes, or even somewhere else on the pelvis, such as on the intestines. And so with endometriosis, a lot of women have very painful periods and quite heavy periods. And then another condition is also adenomyosis. Adenomyosis is basically, we can call it like the endometriosis of the uterus. So with adenomyosis, the lining of the uterus, which is the endometrium, kind of grows towards the muscle or inside the muscle of the uterus. When this happens, because every month the prostaglandins are produced and the uterus contracts. So wherever this tissue underlying the uterus is located, whether it's inside the uterine cavity, which is the normal situation or how every woman is, or outside the uterine cavity, which can be in the muscle of the uterus, what we call adenomyosis, or elsewhere in the pelvis, this tissue, or rather the endometrium, wherever it is, every month when you have your periods, because of the prostaglandin, there's going to be some inflammation and some contraction wherever it is, which is what causes the pain. I hope this was clear to understand, but just in simple terms, endometriosis is one of those conditions that can cause excessively painful periods. And then another condition is PID, which is pelvic inflammatory disease. I think I've mentioned it a little bit when I started this video. So pelvic inflammatory disease is the infection caused by a bacteria mostly that causes inflammation of not only the uterus but the fallopian tubes and maybe even outside the uterus, that causes pain even when you are not having your periods. There can be some pain which is going to be usually accompanied by some temperature and some elevated inflammation markers and all of that. But if you're also having your periods and you have PID, you can have painful periods. What's another thing that comes to my mind? Yeah, the last thing that comes to my mind is cervical stenosis. Cervical stenosis is a rare condition. So this is when the opening of the cervix becomes very small, sometimes even closed, and the blood does not go outside the uterus as much as it's supposed to, and the pressure inside the uterus is increased because the blood is not flowing out. So that can also cause painful periods. So what can you do at home if you have painful periods? When you are at home and you are having painful periods, you can do a few things that a lot of us have probably already tried. You can have a warm bath, it helps, or take like a water bottle with warm water and then just press it against your abdomen or against your lower back. You can also do some physical activity, especially before the menses. You can do exercises and regular exercises and avoiding caffeine, eating healthy. All those kind of things help in reducing the frequency of painful periods. Or if you're already in pain, like I said, warm bath or water bottle, or even taking ibuprofen or some analgesic. You know, it could be ibuprofen, Analgin. There's a lot of them. Non-steroidal anti-inflammatory drugs. This help with pain that is caused by some inflammation. So you can take this kind of painkillers, because I mean, you do not have your period all month. You have it only a few days in a month, and the pain is usually maybe in the first or second day of your period. So it really does not harm you to take a painkiller once in a while. When to call a doctor? You might want to call or contact your gynecologist if you are having not only menstrual pain, but it is accompanied by some of the symptoms such as nausea or vomiting. If you have IUD and you're still having pain, because IUD, you know, especially the hormonal one, is supposed to help with some of the menstrual pain, or some other contraceptives. If you are on them and you're still having pain, time to go and see your gynecologist. Also, if you are passing blood clots alongside with the painful periods, or if you are having pelvic pain outside of your menstrual period, then you should call your gynecologist. So now you call your gynecologist and you go there, and this is what they will do to diagnose the underlying cause of your painful periods. So you get to your doctor, you tell them your symptoms, and they will naturally examine you, do the pelvic exam, and depending on the results of the pelvic exam, actually not just the results of the pelvic exam, they will also do an ultrasound, you know. So they'll do an ultrasound and they will see what the issue is. And sometimes they're not able to figure that out from just the history that you gave them and from the ultrasound. They need to do maybe a CT scan or an MRI, or on top of that, laparoscopy, which is an operation where they make like 3 small incisions on your abdomen, and they use basically a camera that goes inside your abdomen to see everything that's going on in your pelvis. So the laparoscopy actually is like the gold standard for diagnosing endometriosis. It is almost not impossible. It's possible to diagnose endometriosis without the laparoscopy, but the laparoscopy is the gold standard for diagnosis. You know, with it, you are sure that what you see, it is what you see. There's endometriosis, and that's a diagnosis right there. But things like fibroids, you're able to see that from ultrasound, but even just by palpation, you can palpate them sometimes. Yeah. So once you have your diagnosis, then the doctor or your healthcare provider or your gynecologist will taking of treatment. There is a vast number of treatments that you can be offered when you have painful periods, and all of them depend on the underlying cause. Some of the conditions that I have mentioned, fibroids, endometriosis, infections, they all have different treatments. When you have infections, sexually transmitted infections and pelvic inflammatory disease, your doctor is definitely going to treat you with antibiotics and treat the infection. If you have endometriosis, the treatment is quite complex, from the laparoscopy and hormonal treatment. If you have fibroids, the treatment as well goes from removing the fibroids, which is myomectomy, or going all the way to removing the uterus, especially if you are no longer planning to have any kids. The simplest treatments to somebody who does not have any underlying conditions, or who have some of these underlying conditions such as fibroids or endometriosis, but they are not at a level where they need surgical intervention, you can have painkillers. You know, the first ones being the non-steroidal anti-inflammatory drugs, which include ibuprofen or Tylenol. You know, there's a lot of them. Even paracetamol sometimes helps if your pain is not that severe. Your doctor may also suggest hormonal contraceptives. I don't know if I mentioned that. Yeah, hormonal contraceptives in a lot of young women with dysmenorrhea, they help a lot. From the pill to the IUD or vaginal ring, this hormonal treatment help with the menstrual cramps, because what they do is they stop ovulation, and when they stop ovulation, they reduce the menstrual cramps.